Greetings, viewers at home. Sbongile Mbatha. Of course, you are watching Esther for such a time as this. Gama Sbongile Mbatha. Siyanamukela nonke babukele emakhaya. Please tell your friends to tell their friends ukuthi Esther show is on. Niyazi ukuthi it's Thursday today. It's that day of the week, that time of day. It's 4 p.m. Niyazi sihlangana njalo kwa Esther on GNF TV, TV YouTube page, and GNF Ministries Facebook page. Of course, today, it's the month of October. And in October, it's an awareness month for breast cancer. Niyazwi holistic living with Dr. Zinhle uke touch a base on cancer for the past 2 weeks. So Esther niyazwi ukuthi breast cancer is affecting abantu besifazane kakhulu. So it's one of the issues esikhuluma ngazo kwa Esther, because you know Esther, it's all about women. So namhlanje we're just putting a stamp on what Dr. Zinhle has touched based on about the cancer. But we're going to try and cover everything about cancer and all the cancer types that are affecting our women of today. So today I am joined by the most beautiful ladies. I'm going to let them introduce themselves. Hi sis.
Sanibonani, igama lami Monica Mpelo. Ngisebenza e-Cancer Association of South Africa, social worker, community mobilizer.
Welcome on Esther Show.
Thank you.
Sis.
Hi, I'm a breast cancer survivor, but my cancer is come back, so I'm a cancer patient.
Welcome on Esther Show.
Pleasure. Hello. Hello.
Of course, she's no longer a stranger. We, GNF TV, hey? Yeah, we've got Dr. Zinhle today.
But I'm on the other side of the table, so it's, I'm humbled. Thank you for having me.
Welcome. Finally, Dr. Zinhle, ufikile ka Esther Show. Kunini sikulindile, Doctor. Finally, you are here. Welcome.
Thank you.
You guys look good.
Thank you.
Siyabonga.
So we're going to start, ladies. I'm going to start with you, Doctor.
Okay.
Sikhuluma nge-cancer, babukile emakhaya. We all know that cancer, it's one of the diseases, or I don't know how to put it, but it affects abantu besifazane kakhulu, and it's the numbers are getting up. I don't know why, but it's getting bad. So, Dr. Zinhle, please inform us, what is cancer actually?
Definitely. Just before I get into the question, I just have to say to the viewers out there, in case you guys are wondering, in Mangele, she is still a student intern. So, okay. So, cancer. You're right. It's a group of diseases. Okay, we call it. It's a broad term. I hope I mind mix up with English, but it's a group of diseases. Basically, in cancer, you have in your body, you've got normal cells, and the normal cells are cooling is kula, and then after but in cancer, that doesn't happen. Instead, these cells, one, they are not normal, they are abnormal. And in them being abnormal, then they grow at an extremely fast rate and they don't die. Hence, these cells then accumulate. So it's something we can't really see with the naked eye, but it happens in the DNA level. So what am I saying? In the DNA level, our cells are abnormal, ayakula, awafi, they just continue growing. And that generally is a cancer. Yes.
So it's just affecting our cells.
It affects the cells in the body. And remember, emzimbeni wako, you have cells everywhere. So then, further to describe the type of cancer, it just tells you where the cancer is. For example, if you're saying breast cancer, the cells are abnormal, lawakula at a very fast rate, in the breast. Masiti it's cervical, in the cervix. Masiti, so depending on where, in which organ it is, you give it that name.
Okay.
Yes.
I hope viewers at home, you understand now what's cancer. It's affecting our cells, and they're growing fast. That's what Dr. Zinhle is saying. But doctor, cancer? What is the cause? Because our cells, it's normal. I'm a human being. I mailing even our cells, right?
Yeah.
So what causes this cancer?
Yeah. That is a very tricky question.
Okay.
But it's a very common question because people want to know why, right? And I will have to be the bearer of bad news. we don't really know what are the causes of cancer. We can't say ukuthi definitely mawenza lokhu uzoba
Is
ne-cancer.
it?
No. However, we have what are called risk factors. That's what we can tell you.
Okay.
We can tell you the different risk factors for the different types of cancers. And risk factors basically akutshela the likelihood of getting a cancer. So we can't tell you the causes. All we know is that with the DNA level, there's an abnormal, there's a mutation, and so these cells are growing rapidly. We can't tell you what are the causes, but we can tell you ama risk factors. And if sabon good, okay, you have these following risk factors, then you should, your chances of getting a cancer versus lo muntu onganawo ama risk factor are higher.
So we can't really know which cause why any cancer. Ladies, if you feel like adding something, you're more than welcome to add.
Yeah, into mina engingayi-add-a nje ela ngothi uFloy, Sister Floy athi isikhathi esiningi your lifestyle. Athi meaning izinto ozithanda la emlonyeni, like into ezama-sweet, into ezi-oily, into ezi-salt, ebona ukuthi zimnandi kangakanani emlonyeni. Athi most of the time izinto ozithanda la emlonyeni yizo ezingekho right. So mhlawumbe make ekhuluma nge-lifestyle, mhlawumbe izinto ozitshayo ezingekho right, iswekile ixesha elinintsi, i-oil, ubale nama-red meat, processed meat, ezo nto ezo zizo ezingekho right. Then nama unga-exercise uzibeke eriskini yokuthi ube ne-cancer. Mangaba usela utywala, siye sitsho sethi it's bad news. Mangaba usela utywala buyafika budamage lama-cells ala emzimbeni bukubeka eriskini yokuthi ube ne-cancer. Naxa ngaba utshaya icuba lukubeka eriskini yokuthi ube nayo i-cancer.
So it's just i-lifestyle yakho kumele ibe right.
Lifestyle yakho funeka ibe right,
just
balance.
ukuthi reduce, but ayikho cause ukuthi ngempela singathi na into cause cancer.
Definitely not, but we can say risk factors. And some of the things that Umama has mentioned are definitely risk factors. But then again, with each type of cancer is an risk factor. Why? You understand? Some things that may be a risk factor, for example, for breast cancer, may not necessarily be, for cervical. So each cancer has its own risk factors. However, we do have the general risk factors. And among the general risk factors in Sholuguti for really any type of cancer. And things that Umama has mentioned, definitely lifestyle is very important. Being having a big being overweight, it is a risk factor. Eating foods that are high in oil, that is a risk factor. Eating foods that are less in fruits and vegetables, that is a risk factor. Smoking, huge risk factor. Alcohol, we always say if you are consuming a lot of alcohol. We never say consuming alcohol, but say quantify it. If you're consuming a lot of alcohol, that is also a risk factor.
Also to add, ama risk factors, it's a lifestyle, family history, and the environment. So, mangaba family yakho kunomuntu ne-cancer or kunomuntu wayene-cancer, sisitsho sithi nayo i-risk factor.
Because I was going to ask that question.
Ungaba nayo i-cancer, therefore fanele uhlale usenza i-screening.
Okay, so doctor, we all know ukuthi mostly it affects abantu besifazane, this thing. But as I said earlier on, we're not going to touch base only with breast cancer.
Yes.
I want us to just go overall. Yeah. Cancer in general. So what types of, let's say, top 5 of cancer types that are affecting abantu besifazane, especially us here in South Africa or us African women? The top 5 that's abantu besifazane, they are affected by these types of cancers.
All right. So according to the National Cancer Registry, a study that was taken out in 2016, the top 5 cancers that are affecting women in South Africa, 1 is breast cancer, followed by cervical cancer. Yeah. Then we have colorectal cancer, so it's a cancer of the colon.
What is that? If I may ask.
So the colon, yeah. All right, and then we have uterine cancer, so it affects the uterus, womb.
Oh, okay.
Yeah, womb.
Okay.
All right, and then lastly we have lung cancer. So those are the top 5 according to the National Cancer Registry.
But the first is breast cancer.
The first is breast, the second is cervical cancer. However, with breast cancer and cervical cancer respectively, cervical cancer, for example, is the top killing cancer in Black women in particular. All right. When we go to breast cancer, Nakona, mostly there you see it in your white woman, but it doesn't mean ukuthi the others can't get it.
Wow.
Yeah.
Okay, sis Lauren.
Hello.
You are a cancer survivor.
Yes.
So please tell us, which cancer were you affected by?
Okay, now in 2016, I was diagnosed with breast cancer. And then I stayed for remission for 2 years and 6 months. And then after 2 years, 6 months, and then I found out that I've got metastatic cancer, which is a breast cancer, CA. But when it's metastatic, it's no longer on the breast. My breasts are clean, but it has spread all over the body. So what's happening is now I've got, you can hear my voice, I've got lymph nodes on my throat, it's on my chest. There's one inside the lung, there's one outside the lung, it's on my abdomen, and it's also on my blood. So that's stage 4 cancer. So no matter how small it can be, no matter how small the tumor it can be, because it's already spread in the body, then it's called stage 4. So that's the type of cancer that I have.
So you find out in 2016. So you went through the so bathola ebeleni.
Yes, what happened is that in 2016, I found out there's a lump. And then when there's a lump, then I went for a mammogram. After mammogram, I went for breast cancer sauna. After a sauna, they saw something irregular. There were 2 tumors in the breast on my left. The right didn't have anything. So underneath, there were 2 tumors. So they were both positive. But by that time, surprisingly, they were both on stage 1 in January. And then come February, when I was doing an operation, the cancer had spread into stage 3B, whereby the glands was starting to move now. It was starting to move
to other parts,
but it was yeah. Then my operation took 6 hours instead of 2 hours, and then after that, I went on treatment, and I went on chemo. I went on normal a chemo for 21 sessions. But when they give you the red chemo, it's normally 6. And then after with the blood test, when it reduces, they will put you on the light one. Then after that, I went for radiation. The radiation, you will see that your breast changes, it becomes black. And then after that, I was on remission. But when I'm on remission, they gave me the tamoxifen. The tamoxifen is a tablet that reduces your menstrual cycle. So I don't have to be on menstruation while I'm on remission, because most of the time fertility, it affects it makes the cells to grow, so it becomes positive, because as the doctor has said, they don't know what causes cancer. However, in breast cancer, they will give you the tamoxifen so that you don't go on your periods, because sometimes when you go on your periods, your breast changes, they become heavy, they become sore. So when there's fertility changing in your body, that can cause cancer. However, also it can come out from the gene from your family. And again, eating junk, drinking a lot of sugar. But the sad part is that it's not known exactly what causes cancer.
Yeah, hey.
So, Sis Lorraine, uye wazizwa kanjani the first time bekutshela ukuthi une cancer?
I think because it was just a name. I didn't take it as a shock. I didn't, I didn't take it like now what I understand what's happening with cancer. I took it like a flu. But when it went deeper, that's when I started.
So you got sick?
No, I wasn't. I was healthy as I am. You see?
No, yeah.
You see how healthy I am. See, in 2016, I was just like this.
But you went through the treatments.
That's the danger. That's the danger of cancer. You look very nice. It's smart. It's swimming in your body, only to find that it's eating you bit by bit. When you open your eyes, it's already damaging your cells. Because now, if this one that came back in February, it was not detected early, maybe we'll be talking something else.
Oh my God. Scary, hey? But hey, we're gonna be fine. We're going to be fine. We're doing an awareness with Sibabugile Makaya. It is there. But nangu sisi, what I like, usisubukeke healthy, but as Esho ati, you'll find out that you look healthy, but this thing is eating you silently. That's said about cancer.
Yes.
So we have to look after ourselves. We have to take care of ourselves. Look after a lifestyle to Sababugeli. Okay, sis, do you want to add something?
No, bengisazo add nje ukuthi early detection saves lives. Into ebalekile njalo once a month umuntu azenze i-breast self examination whereby umayicana kwesibili ucheck amabele wakho, check isize amabele wakho ukuthi ngabe sese right, isize oyijwayele, uchecka ikhala yamabele wakho ukuthi ngabe amabele wakho awachangeanga nekhala, uzupresse nama nipples, ucheck ukuthi akuna gazi or discharge ephuma kuma nipples, uze uphakamise izandla zakho. Ucheck la i-breast density so that i-shape uzoyibona kahle uma uphakamisa izandla ngoba la ikhwapha likufitshane nebele uzocheke nala ekhwapheni ukuthi akuna lampu, ucheke nakwelinye side ukuthi akuna lampu na. Mase uqedile ulala ngomqolo embedeni, uqale wenze i-breast self examination whereby uchecka ibele lakho, wenze sure ukuthi ujumpa so uyenze clockwise so that uzoyifeel ilampu, upresse nala kwi-nipple ukuthi akuna lampu na. Then mangabe ubona any sign, even if you want a sign A1, awulind uyahamba uye clinic or idokotela or uye esibhedlela so that bazocheck ukuthi yini.
Okay.
Yes.
So Sis Monique, I was supposed to ask before siqhubeke nendaba. You are from Cancer Association of South Africa.
Yes.
So tell ababukele emakhaya ukuthi yenzani this organization. Because this year's good to but what programs do you guys offer? What support do you guys offer? Yenzani kahle umuntu ongafika athi yenzani Cancer Association of South Africa? I-Cancer
Association of South Africa, we educate people about cancer. Siyahamba siya ezikolweni sifundisa abantwana abasesebancane so that bazoyi-understand i-cancer besesebancane. Siya emakliniki siyabafundisa nge-cancer, siya kuma-corporate siyabafundisa abantu nge-cancer. Siyabasupporta abantu asebene-cancer. Siyabasupporta ukuthi senze counseling, sinama-support group wethu. Siyabasupporta ngezinto ezifana nestoma, abantu abafuna istoma betshila usisi athi i-colon cancer nayo ikwi-top 5. So abantu abafuna i-stomach bags siyathengisa i-stomach bags, siyaya sibaklinele, siyenza ama-home based care. So i-Cancer Association yenza lonto again siya researcha nge-cancer. So that sizokhona ukuya kahle ebantwini ngento esiyaziyo. So we research about cancer, also we advocate for the patients.
I was about to ask my second question, Guti. What kind of support in offerisha the patients abane cancer as the Cancer Association of South Africa? What support?
I-support esiba offera yona ngithe one, i-counseling.
Okay, give them counseling.
Yes, umuntu make diagnosed ne-cancer kuba ishock.
Yes.
So udinga umuntu ozomsupporta. So siyabasupporta nge-counseling, sinama-support groups amaningi la eGauteng nakwezinye indawo ezine cancer. So siyabasupporta ngama-support groups, home-based care. Omunye ufumanisa uhlala A1 okanye during the day abantu basemsebenzini. So kusinama volunteer wethu abayele ezindlini for home-based care. Abanye siyababonisa ukuthi how to clean stomach bags. So i-support esi-offerayo leyo. Abanye ufumanisa une-cancer akanambhede wokulala. So siyababoleka imibhede, siyababoleka ama-wheelchair. Yes.
Okay. Wow.
Ama-centers wethu sine-center ese-Johannesburg.
Okay.
E-473 Main Street, it's a care home. E-accommodator 30 patients. Accommodator abantu abakwi-treatment already. Aba-attenda eCharlotte Maxeke. Fumanisa umuntu uhlala kude le kwabo Niger for example. Aka-afford imali ye-transport yokuya esibhedlele nokubuya.
And mawuphuma azohlala leyo center leyo.
Yes. And mawuphuma kwi-treatment ukhathele. Usisi uzositshela mo. Ukhathele mawuphuma kwi-treatment uyabona. Besides financial. So siyaba accommodator. Sibahambise esibhedlela, sinekhumbi yethu ehambisa abantu esibhedlela. Siyaphinda siyabalanda. Sibanika emails. So for umuntu la 6 weeks asekwi treatment, uyayazi ukuthi usafe unendawo yokuhlala. Then we open from Monday to Friday. Friday mabeqeda treatment bayahamba baye ezindlini. Bazobuya Monday again.
Okay.
Yes.
Dr. Zindla, I always say I appreciate our bishop for allowing us to air such shows ebantwini, because especially with us Africans, as the Bible says, my people perish because they lack knowledge.
Yep.
Uyabona khona manje, I didn't even know mina ukuthi i-Cancer Association does all
Does
that. They
such,
even have a center ukuthi ma ungakhoni maybe traveler to go to a hospital, you can go to the center uhlale khona, and then they kunokudla kunayo yonke into.
Yes.
Wow. So babukela emakhaya, if ever you know someone on a problem ye cancer and they are not aware ukuthi Cancer Association of South Africa yenzani, usisi just told us ukuthi they give a support, they give counseling, they give a support to everyone on a cancer. So please, we need to use these organizations. These are the government organizations, right?
So we are NGO.
Or NGOs.
Yes.
So, but you get funds from the government.
Yes, we do.
So we need to use such organizations. Singa perish because we lack knowledge. Yeah.
Definitely.
Yes.
I have to say, Ubuti, indeed, the fact that we have such shows as yours that actually bring this type of information to people is amazing, because now Umuntu can always just go and read up and say, oh, okay. And another thing, especially with us Africans, we think like cancer is a white thing.
Yes.
No, it is not a white thing. Cancer attacks the cells. Cells are not white, cells are not black.
Therefore,
Cells are
we
cells.
all have cells.
Exactly. So it is not limited to particular people. It is not limited to people with, for example, a wild lifestyle. I mean, I don't have a wild lifestyle. I won't get it. Definitely not. But definitely we can go through the other risk factors as we discussed the different types of cancers.
Okay, doctor, you'll take us through those cancers. Just explain to us, okay? Breast cancer. Just tell us. And how do we diagnose cancer? Because maybe is it so feel like, okay, at least the breast cancer to us teen all these, but I'll let doctor do that for us.
Okay, so the diagnosis of a cancer, and once again, you may find most of my answers will say it depends, because it depends on the type of cancer. So for breast cancer, so I'd like us to at least focus on breast cancer and cervical cancer.
Okay.
They're extremely
All
common,
right.
you know, and they actually are national disasters, I must say. And so the government has put in programs in place to better the screening so that lama cancer are tolerable early. Because once again, as Mama said, early detection is key. The sooner we get it, the more options we have on how we treat it. And ama cancer wafani, they're different. You may have breast cancer, for example, Lucisi mentioned, she was diagnosed in Jan, they picked it up, and then you said you had the surgery in February, and then by then it's in stage 3B. And then you get other cancers like cervical cancer, for example. It takes about 20 years before it shows. So when for 20 years of your life, you're living the best, everything is amazing, you get to the age 40, 45, or you get to menopause and you're still bleeding, cervical cancer is there.
Oh,
and
that's the womb one.
Yes. And the sad part with cervical cancer, really, by the time it's diagnosed, most cases, it's too late. And it has spread.
Can I add on cervical? Because I think as ethnic people, as African, we are shy to tell our girl child and our boy child, they stop sleeping around. Because on the research, the most causes of cervical cancer is the husband that is cheating or the girl that was sleeping around while he was young. So when you get that cervical cancer, most of them, they are caused by that. So when your child is 12 years, they take a girl child to go and have an injection of HPV. That prevents, that will help you not to have cervical cancer. But my concern is what's happening about the boy child. So parents out there, bazali, bantwana benu, tombazana, mntwana womfana, yekani stop sleeping around because nigulisa abo mama. That is why we tell you most of the patients, the cervical cancer, abo mama abadala. You don't know what abo baba bebayenzani. Bahamba balala ngaphandle. Ngoba it's killing us. So it's very important that we are very aware of cervical. And singasabi ukukhuluma about cervical cancer. Ngoba that's the most danger of us. What is happening in the society.
Wow.
Definitely.
Wow.
Yes.
Eh? And I'm shocked it takes 20 years. Ungaphila for like your youth, your adulthood.
Definitely.
Unayo this thing.
Definitely. Okay, let's talk about, since we are on cervical cancer, let's just finish cervical cancer. All right. So, in the structure of a female, you have the vagina. Okay, that's the one, we can see a part of the vagina
Yes.
from the outside. And then up it goes into the cervix. We call it umlomo, the womb.
Yes.
So that is where
The
cancer, iqala khona, kulo mlomo. Remember, I said earlier we have what we call uterine cancer, and it's cancer of the womb. So the womb is ila umntwana ahlala khona. All right. So singa confuse ini is cervical cancer ne uterine cancer. Two different things, right? So we want to know what are the risk factors of this cervical cancer, and as Osese has mentioned, one of the most common risk factors of getting a cervical cancer is what we call the human papilloma virus. It's an infection. And this is a sexually transmitted infection. Yes. So in most cases of cervical cancer, usually patients have had HPV infection. All right. Then one was okay, so how do people get HPV vaccine? Obviously, we've already said it's sexually transmitted. Who can transmit HPV virus? Anyone that has it, both males and females alike. So then, so if men can also get the HPV, why don't they get an equivalent cancer? Well,
God
right
knows.
now we don't have that. But again, we mustn't scare people. They need to know that there are many types of HPV viruses. But lawa akoza cancer are particularly types 16 and 18. Those are the ones that are danger. So it's HPV. That's one. Secondly, an early age or early onset of sexual debut. So people have sex at a young age. Why? Because they have more risk of being exposed to this virus. All right, that is that. And the next one is, women that, how do I put it, that have children after the age of 30. All right, they have children after the age of 30. That is also, a risk factor.
Oh my God.
Yeah, and then obviously we also have all the other risk factors that I mentioned earlier, lifestyle and all of that. So, and another thing, having a lot of sexual partners. It's important to practice safe sex. Have one partner and use a condom, because if you don't know who your partner is sleeping with. And that on its own is a big thing. But if now in Owako you have a lot of sexual partners, that is a problem, right? So now what can be done? How can we prevent this? Really, more than anything, it's all these changes, these lifestyle changes. You don't want abantwana that haven't yet started having sex. You want to do sex education, and women that have not had sex before, between the ages, we say now 12 and 26, they can get what we call the HPV vaccine. The HPV vaccine, we get it in government, we also get it in public. I must say it is in private. It's extremely expensive. We have what we call Gardasil. It's good, but it's expensive. But then again, rather spend a couple of thousands now and save yourself from having cancer later, right?
Yeah, true.
Exactly. So in government, on the other hand, ababukela makaya, if you're between the ages of 12, they even lowered the age.
From 10 years.
From
they
9.
can
From 9.
exactly.
Oh,
yeah.
So 9 to 26, and you haven't been sexually active, they can go and get the HPV vaccine. So cervical cancer is one of those cancers where we can say singatnika logu ukuthi sizama ukuyi-prevent. Unlike breast cancer, on the other hand, there is no vaccine that we can give to you and say singakujova this and it can help in preventing the cancer. So that's why each cancer is different. And that's why it's difficult to just in general discuss each and every single one of them. So as Umama said, with breast cancer, in order for it to be diagnosed, or how do we diagnose it, one of the important things with the breast cancer is self breast examination. That is step one. From there is clinical breast examination. So yagu doctor gelap. And then nakhona, once we've done that clinical examination, depending on the lump, we want to take a biopsy, we want to do a mammogram, we want to do an MRI. It depends on the type of cancer. Whereas with the cervical cancer, the new friend, your new word in your dictionary must be pap smear. If you have started having sex, my dear, pap smear needs to be your friend. Because that is the screening tool that we actually have. And I must say, it is very effective because, so if pap smear, basically, it's a very invasive examination. But trust me, it is good. Like izokusiza. So what we do is we go into the vagina and we go particularly through the vagina into the cervix, and we get some cells. Remember, cancer, cells. So whatever we got, and we'll see, okay, these cells are not normal. Once we see abnormal cells, that patient has to come back. We need to investigate. Could this be a cancer? So we do further tests to see, is this low grade cells? Are they high grade? What do we do? Is it a cancer? If it's a cancer, we need to stage it and then we need to treat it accordingly.
Wow.
Yeah.
Do you want to add something, ladies?
No, bengizobuza ku-doctor ukuthi ngike ngezwa bathi xa ngaba ufumana ama-hormone replacement pills.
Yes.
Uzibeke eriskini yokuthi ube ne-cancer, specifically i-breast cancer. So ngicela unicacisele kakhulu kwinto edibene nama-hormones.
All right. So this one is also a very tricky question, because then one says, should I then stop using my oral contraceptives? So what we say is oral can unopposed hormonal therapy, meaning, so if goma contraceptions, we have what we have. Estrogen, kona manyama pilisi, they purely inject estrogen. Amanyege, ama contraceptives, they have estrogen and progesterone. Another two, they are safer than the ones that don't have. But at the same time, we're not saying if you're definitely using oral contraceptives, you will get breast cancer. But the risk factors are slightly higher. So definitely, I'm oral contraceptives, and I must say unopposed. Oral contraceptives are a risk factor, but that doesn't mean you will definitely get it. So if you are taking contraception right now and you know unopposed, but is the other cause of cancer? No. Rather go back to the clinic or your doctor and discuss other options, other alternative options.
Yes. And the other thing on cervical cancer, especially abantu abadala, uzothola ama youngsters athi ugogo wami uye emalangeni akaqedi. So once ugogo aqala emalangeni angaqedi, ungameli uthatha isikhathi, take the doctor to the nearest, take your grandma to the nearest doctor bayomcheck ukuthi ngoba sometimes uzothola ukuthi sekuyi-cancer seyizivezile. Even nabantu besifazane, when you menstruate, stop continuously. Don't take things for granted. When you've got period pains, we're not supposed to have period pains, but thina sithanda ukuhlala sithi hayi ama-period pains, abantu bathatha ama-grandpa, bathatha ama-Nurofen, bathatha ama-onion, bahlala phezu kwamabhakede. Once you've got anything that is abnormal in your body, run to the doctor.
Okay, I need to know. I love that. You have to know. For a moment,
guys.
when she says you're not supposed to have period pains, I'm like, oh. But once now that you say that when there's something that is abnormal, and that is the key message that we need to take. We always say, umuntu owazi umzimba wakhe more than anything is the patient. So you know your body. Right. So if you're used to a particular types of period pains, you know what you're used to.
How many days?
And then suddenly they're different. Suddenly it's something you do not know. So it's different from the norm. Then it must be a cause for concern. Even with your breast, you do your self-breast examination. And she mentioned already, you do it in front of the mirror. Firstly, you want to look. Before you touch, you want to look. Is there anything so you first start by looking. And as she mentioned, I always say, do it one side at a time. You do the one breast. When you're done, you compare what you found this side to what you found on the other side. So when you're doing the right breast, for example, you will lift your right arm. Why are you lifting it up? You want to be able to view the axilla, all right? Because we know the breast goes and it extends over, so you have to go and you feel all right? So it's very important. And then you've looked, anything, fine. Now you need to feel. Anything is into there, but you can't see them. You feel. If it feels different, when you want to corniscate or whatever, that it's always there. If it's something that has always been there, then okay. But once it's something different from the normal, so that's what I'd like Ababugeli to take. Anything that is different from what you are used to, you want to go and get it checked out. It doesn't matter how small it is. It could be a lump this small. It could be a big lump. Ungalindi ukuthi kube nama symptoms mhlambe, like don't wait for weight loss. Don't wait for the fever. Don't wait until things are bad. Anything you notice that is outside of the normal, you want to go and get it checked out. Because we already said, cancer, it's a very tricky disease. It's very tricky. Other people have symptoms. Other people don't have symptoms. My sister said that she didn't have it. She was healthy. She was fine. But she had cancer. Which needs to be a message to everyone. Which cancer we can't say, okay, because omunye umuntu uzothi but azange ngize ngiluze inywele. I thought abantu be-cancer baluze inywele. Not everyone loses their hair.
Can I come in there? What happens is that when we're losing our hair, you are now a patient, ne? You are taking treatment. You are on a red chemo. Then when you are on a red chemo, inywele ziyaqala ziyathuthuka. That is why you find most of cancer patients, they look like aliens. And then ikhanda liyashine so, and then malishine, you even lose your eyelashes, you lose all your hair in your body. You don't have anything, and you get hot flashes, you get nauseous. When you're on chemo, you even forget. Sometimes you've got a brain cancer. We call it a brain cancer because you can put a phone here, and then it is not you, it's the tablets. That's how cancer works, because when you're on chemo, it kills the entire cells. When it kills the entire cells, it's dealing with like all the cells that are in your body, they die. All your white cells,
even the
die.
good ones,
all they die, and then they have to come back. That is why when you're coming back from red chemo, you need to be on isolation. You need to stay in the bedroom. The family, you need the support from the family. They need to understand what you're going through. You don't have to have so many visitors in your bedroom because it's very unhygienic. You need to avoid to be next to the children because the children, they're easily infected. So those are the awareness that people need to know. And when you are on cancer, it is very important that all your family get the counseling. You prepare them the journey that you're going to, and it's easy lately. You don't, sometimes it's not always a must to you can go to the social worker. Banipi counseling, sometimes some counseling are traumatizing. But if you go and read the stages of what's going to happen, know what's happening with your sister so that you accommodate. Be impatient. Sometimes you are more pregnant, you sometimes have the hormones like a pregnant woman. Yes, nini, you want to eat Nando's. Mabai later, you can't eat it. Nini, ufunum dog outside food. And in what people are not aware. When you are with your partner, some of the partners because they are frustrated with umfaz wam une cancer. Same applies nomfaz, indota mine prostate cancer. Uyamkwatela indoda yakhe kanti I understand what's happening. So it's important that you teach your partner, you teach your husband, you are at home, teach your family. If you've got grandparents, if you've got young ones, if there's children in the house, let everybody know about cancer, because with cancer you must all walk together and you will heal together. You can't drive yourself when you're going to chemo. You need somebody to support you. Hence, Ashilo Umonika Uguti, Cancer Association, they take those patients from Bomashelot Makteke, Baba Hambise. Mara, not to say I am saying cancer is not doing enough. I'm very concerned about What happened to home base yase Orlando? That people at Soweto, where do they go? People from here, Alexander, where do they go? People from Limpopo, where do they go? From Northwest. So more and more and more of homes needs to be open so that people must know. The way people, they rush into Instagram, the way people know, we can talk about Skokstad. I'll make an example with a gospel singer. Umenshina Uleb, this girl, she just produced one song. She's known all over Africa, but cancer South Africa, that is where I think, that is where it's lacking. Come out there, you are a big NGO. There's so many small little NGOs that are there, but the challenge comes in. Come October, everybody's running with the pink ribbon. Everybody's calling awareness. No. Everybody, it's a plea from my experience. It's a plea to everybody. Everyone on the organization, our government, the Department of Health. I'm challenging the minister. Let the minister elect and choose one organization that is big, that is going to be the mother body, that is going to make sure with all these young organizations, they go and teach the kids out there, because early detection is better. Because here we're talking research, we educate, we support. Education. If one organization, they go to the kids when they're 13 years, they educate them about the cancers. Don't leave out the boys. There's prostate cancer. People need to know about prostate cancer. Abo baba, mawuqala ubona ubaba magaya endlini encane, umchamo wakhe mawele esayidini. You must ask yourself ukuthi kwenzakalani. Makaqala achama, uzwe ukuthi man lo mchamo wakhe awusathi tor uthi shh. You must have a concern ngoba mawusone prostate cancer uthatha isikhathi. Nibheke abomkhulu. So i-cancer iza ngendlela ezinye, and i-family history is important.
Yeah,
family history is important. Awareness is, it's a plea to cancer, my sister. I'm on private. I get all the medication on private. I don't get.
What about
anything.
Someone who's public?
What about someone who's on public? And I'm a go-getter. I go and out and ask. I find out for myself. What about people that are not like me?
Maybe a village somewhere, KZN or Limpopo. Yes. Such information.
We need and home. Let's say care home. Leya home ihleli ejipi. Ifihlekile ekhoneni. Ayibonakali. Only the patients that goes to Charlotte Maxeke. What about my patient as
Alexander?
What about my patient as Alexander? What about our Fosloras? I can mention a lot. There's a lot that we need to do. We are going to talk about the cancer now. It's October. Abantu bayenza ngathi fashion. Come next month, zoo uthulile. We cannot live like that. Cancer is killing us. Cancer is there. It's reality. But we need to change. We need to do something. Monica, from cancer, I am challenging you guys. You really need to do something, my sister. We really need to do something about it.
Cancer Association, sinamake homes amanensi. For example, kune Pretoria for Gauteng North. Kune care home le ise Joburg. Joburg I accommodate only GP patients. Abasuke Alex, abasuke Foslo, abasuka kwa Nigel, yaba accommodate as long umuntu edinga imali transport, as long umuntu ebona ukuthi angekho khona ukusuka endlini aye esibhedlela ayikhethanga. Nako Limpopo kunama care homes, Cape Town, Bloemfontein, East London, Kobo PE, Nelspruit.
I think
so
the problem that we have,
yes,
we don't get much education about cancer.
It's true.
It's still lacking. The organization does the I didn't know about that because as he told you education ain't enough. As we said, we urge you guys, go out there, teach the community. If it means come to Alexandra Township to teach people about cancer, please come, go to schools. Go to even at the bundles of KZN. You have to go there. Especially about Labasemaka, I think they suffer more than at least it's a city. So everything is accessible. The resources are accessible. How about KZN? Deep rural. Maybe Seteben. And that's a distance to drive from Nongoma to Durban.
To Durban.
So we need such education. I think Usisu right. I think there is a lack of awareness. Ngoba shathi, come October, we all busy with cancer, what. Throughout the year, we're not looking at it.
Okay.
Yeah, so I think your organization have to
ndifuna
put some-
ukutsho
up
ukuthi
some-
i-Alex abo
Yes.
Alex clinic siyaye e-clinic zase Alex Alexander nje yona ngoba vele siyaya njalo kuyo Alexander siya educator abantwana esikolweni ngecancer.
Okay.
Nase KZN khona i-care home ese KZN. I believe and
Okay,
I
how many-
trust abantu abase KZN ukuthi bayawenza umsebenzi.
Okay, so you've got branches across the country.
Across the country.
Every province.
Yes.
Okay, all right.
I
So-
think more than anything, I don't think we should say we need cancer awareness, but rather health in general.
Yeah.
I think that is the main thing, health in general. Because from a person that has been exposed to cancer, cancer is their killer. From omunye umuntu egibo, maybe there's a mental illness. For bona,
Yes.
mental illness is a problem.
Yes.
For omunye umuntu, maybe that comes, there's diabetes or strokes. For them, strokes is a problem. So as opposed to saying we need to teach about cancer, I think we should say we need to teach about health
in general.
general.
Because if we cover health as a whole, we've covered everything. We've covered cancer, we've covered males, females, we've covered every types of diseases, really. And where do we go about with that? Definitely, we want to start it at the young age.
Yes.
Where are most of our young ones staying in
It's
school?
primary.
Exactly. So I really believe it should be incorporated into the education system. But that's a story for another day.
Yes.
That's
Yeah,
what I
true,
think.
eh?
You know, it should start there in the classroom where, you know, there's subjects like life orientation is
Yes.
teaching them about
It should
this
be
and about
included
that.
in
But I think now
such.
we need to be very specific.
I think we can write a textbook, you know, about it.
And to add on that, Doctor, if i-government nayo ingakhe yenze the way ibiyenze ngakhona kwi-HIV and AIDS, kungaba right because i-Cancer Association iyi-one.
Exactly. It can't do everything.
Angeke yenze
We
yonke into
can't
iyi-one, but
expect them to
u-government
do
make enze njengoba benzile kwi-HIV and TB njengoba usisesitsho kwi-life orientation abantwana kube nama-textbook bafundiswa nge-cancer yonke loo nto leyo kungaba
I
right.
think cancer it's one of those diseases that at the our notice
Yes.
ukuthi they are killing it.
Yeah, we took them for granted.
Yeah, exactly.
And because we took them for granted, they just continued. It's like afigile, and now they just, you know. And more than anything, abantu babona seyifigile ukuthi oh my, cancer. My mom had cancer. Does it mean I'm gonna have
Yes.
cancer?
Okay, that question is it genetic?
Right.
It is.
So the answer is no.
Okay.
I don't want us to say, so cancer is a genetic disease. Let's differentiate that, Gangan.
Okay.
It is a genetic disease, meaning in the DNA level,
Yes.
all right, lapho kunama genes wakhona. Your genes tell us ukuthi, what should the cells do. That's what the genes do. So when we say, so umuntu uzothi, is it inherited? No, it's not inherited, all right. Ukuthi umamakho bekane cancer, uzoba ne cancer. It's not inherited. Instead, what you can get from your mom that had cancer are the genes that are abnormal, not the cancer itself. You understand? And I'm going to make an example. Please allow me to use you. If now you have cancer and you have a child, you will not pass on breast cancer to your child. But what you can pass on are the abnormal cells. So it's not the cancer itself. And that's what I really wanted to clarify. You can't take a cancer, but no. But if your mom, for example, had breast cancer, will you have cancer? The answer is yes and no. Why am I saying yes and no? Your chances of getting breast cancer versus umuntu mamakhe bekangana breast cancer are higher. It doesn't mean you will get it. It doesn't mean you won't get it. Kanti at the same time, nalo egibo there is no family history. Akusho ukuthi naye angaba the first one. You know, ingaqala ngawe. But definitely, if there is a positive family history, it simply means your chances of getting it are higher than umuntu la there is nothing.
Wow.
I hope that is
Yeah.
Yeah.
awukwazi ukunikeza omunye umuntu breast cancer. Awukwazi ukunikeza umntwana nakhe cervical cancer because, for example, you have cervical cancer. No, but so it's the genes indaba ilapho.
About genes, the problem.
Genes.
Okay,
And
yes.
the other one that is not for the genes, it's smoking, ne? The air that we breathe in. Because I've got a colleague that's got a throat and the eye cancer. She inherited the cancer because the husband was smoking in the house. And the sad part of it, when she was diagnosed with cancer, the husband divorced her. And how it started, she had a toothache. Yes, she had a toothache and then the throat was sore. And then she was taken to different doctors, but there's the doctor that said, no, go and do an x-ray. When they've done an x-ray, they found that there's something underneath. And then I think she was diagnosed with that cancer for the face in 2014. And then this year during the pandemic, her eye had cancer, and then they had to remove her eye. She's also one of the patients for cancer. I think you know her, but I don't want to talk about her name. So yeah, now the sad part is about smoking. Even now when she speaks, her saliva, she gets dry. She needs to drink a lot of water. And now her face, she doesn't look okay. So people that are smoking out there know that us that are inhaling, we are at danger compared to the person that is smoking it. But when you're smoking it, you must know that your chances of a cancer throat and your chances of getting a lung cancer are very high. So when we speak of breast cancer, let not just concentrate on breast cancer, because I, for myself, now I've got a throat, I've got a chest, it's on my lung, I'm taking a treatment. It's very little centimeters, you won't believe. It's six by 5. Wow. So little. But let me tell you, that little cells, it has just made it to go on stage 4. So don't take cancer for granted, because it's a silent killer. You die smiling, you die like living a normal life. But now when it damages your organs, if your liver is done, your liver is your kitchen, you clean everything. If it doesn't function, you come, I will tell you, yes. They will bring the family and tell them that, you see how healthy and how good she is. However, her liver cannot function anything in her body. Your lung cannot function anything. So let's not take cancer for granted. It's serious. It's serious. It's serious.
Wow, ladies, thank you so much.
And to add on that, smoking, as we mentioned that smoking naso sukubeka risk yokuthi ube ne-cancer. We have primary smoker, we have second hand, and we have third hand smoker. Meaning, mangaba inguwe ochayayo, you are the first hand smoker. Mangaba njengoba sihleli so, fumanisa ba wena uyachaya. Then we are the second hand smokers. Then kubekho ke ngoku what we call third hand smoker. Lapho ufumanisa ba umuntu uyachayela endlini. Awukho that time. Mhlambe uye kwi shopping. Mawufika uyafika, you can smell ukuthi kunomuntu ebechaya la. So you are the third hand smoker.
Wow.
Yes.
Thank you so much for this information, ladies. Thank you. I hope viewers at home, you've learned something. I've learned something. I must say, this cancer, I think it's ignore in a way, but it's killing silently. So ladies, 1 second, we don't have time. Just a message about the cancer. One each, especially for, okay, let's say your organization. From the Cancer Association of South Africa. Just give a message to ladies. 1 second.
Message mna engashiya, early detection saves lives.
Wow.
The message I can leave for the viewers at home is that know your body, do a self-examination, eat healthy, reduce sugar, and stop eating junk.
Wow. Sinclair?
What I can say is there are so many things that you're not in control of. However, the little things that you are in control of, take charge and make the right decisions. You can stop smoking, so stop smoking. You can reduce your number of sexual partners, stop that. Anything that you can do, change your lifestyle, change your habits. You can go consult if you think something's wrong. Whatever it is that you can take control of, please do it. As for other factors, genetic factors, things we don't know
We don't
of,
have
ayikho into ongayenza ngalokho. But what you can, definitely do it and make the right choices.
Wow, thank you so much. Viewers at home, there you have it. But about Dogotela, we've got a cancer survivor here. I mean, I always say, akekho umuntu ozositshela story other than someone oke go through that process. Uthi usisi, your lifestyle is very important. You know your body. Akekho umuntu owazi umzimba wakho ngaphandle kwakho. As soon as kuba ne pain, kuba ne something that is strange with body yakho, please just rush uyokwenza check-up. Because this is, as I'm saying, this is a silent killer, but you can live for 20 years, une cancer emzimbeni wakho, and you can even die. Ubuke ku healthy njenganathi, uyasibosi ibukeka si healthy. We don't know, maybe we've got that cancer. So please, 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 let's take care of ourselves. You know your body. I mean, that's what I've just picked up. You know your body. You know if kunente awkward or something that is not right kumzimba wakho. Rush to the doctors, they examine and find ukuthi yini wrong with your body, and let's live a healthy lifestyle. Exercise, eat healthy, especially with Africans, we like ukudla nje okungekho healthy. Let's try and be healthy. It's our health, it's our bodies. We have to take care of our bodies. Akekho umuntu ozokunakekela emzimbeni wakho other than yourself. So viewers at home, I hope you've gained something on this show. Siyabonga for watching us. So, ladies, you can just say bye to our viewers.
Bye.